So I'll touch briefly on some things that we're doing that kind of create the links with coastal health and Jat, and then look forward to hearing his presentation. And so, of course, my assumption is that you do know a little bit about our City of Vancouver long-range transportation plan, and we've got two major goals, and we're actually soon going to be reporting out how are we doing in terms of last year, 2014, as we track ourselves towards that 50% greenest city walk, cycle, transit mode share by 2020, but of course we're headed for well beyond that with growth in 2040. Again, thus vote yes for the referendum. But the cornerstone of the plan was not just about one thing, it was about economy, people, and environment. So the connection here with active transportation and health really centers around on the people aspect of the plan. And so in previous years, we at City had an economic strategy, and then that followed up by the Greenest City Action Plan that I've referred to, and then just last fall, Council approved the Healthy City Strategy. So I just want to help you understand a bit more of the links in transportation with that. And so as all good long-term plans, there are targets and indicators for the next decade. And then now there's coming back in the next month or two is actually an action plan as it relates to Healthy City. And so the links there for getting around really do build upon the Greenest City and our Transportation 2040 plan. I do want to highlight that just the graphic itself shows you that the two fastest growing modes from the last time we reported out data is walking and cycling. And of course, those are great ways to not only move around, but to be healthy in. But the other things that when you look at it from a health lens, that we start as transportation planners and engineers also start looking and talking about, well, what about environments to thrive in? And it's not just always about how you make those choices on how you're going to move, even if it's for recreation or your commute. And so we're having other things like walk score, which is a really good indicator, particularly on the land use side. You have a lot of those destinations, and so we got some goals around that. We at the city really want to be able to kind of look at the mode split goals and including health on a more of an annual basis. So you hear a reference of this in the weeks and months to come about a panel survey. And so essentially we benefit from TransLink's trip diary, which comes every 3 or 4 years, but now we're going to be doing our own Vancouver panel survey. And so what I'm really interested in Jat's talk in terms of this is that this was actually a health question that we asked last year in the panel survey. It's a general question, is that what we can then do as we learn about who walked and cycled and took transit and drove in around our city and for what reasons, kind of make that correlation to health. So it's the beginnings of how we're going to try and grow and not just understand transportation, but understand the transportation and health connections. Just a reminder that we at the city always do this work quite often in partnerships, but more and more so we've been doing this with health partners. And if you've heard this word, great people to work with in terms of kind of helping build a city. So just to recap some metrics, walking, as I mentioned, is one of the fastest growing modes. The other target that we have in city, of course, is safety. And so what this slide is showing is not only has walking increased, but the overall collision rates are on the decline. And so there are more trips happening, and unfortunately there's still collisions happen, but we have a Vision Zero fatality target, and there's more work to be done, but at least the progress over those 3 years is a positive one. And then you look at cycling, and cycling is actually the fastest growing mode in the city of Vancouver, and it as well, though even though the number of collisions for cycling is still actually at a plateau, but because there's such an increase in the amount of cycling, the actual collision rate. So it is the safety in numbers effect that you maybe have heard and read about is happening actually in the city of Vancouver. Now, this is actually some new data that we're happy to share. This actually data on this slide is available online if you're interested. It's actually all of our permanent bike counters. But I just want to break it down for you, because when it was, what's blue, what's green? Well, blue is the last full 12 months of permanent bike counter data at all these locations. And who would have guessed? Science World, with that counter there, the permanent bike counter and the display, Science World at the seawall had more people biking by it over the last 12 months than Burrard Bridge. I've always described Burrard Bridge as our busiest bike lane in the city. So the benefit of actually getting this kind of continuous 24-hour, 365 data at a location which of course speaks to not just a kind of commute, but certainly to commuting and to recreation and people just kind of enjoying their days in and around Vancouver. And then you look at Burrard Bridge, the green is the year before, we had a 30% increase. Now, of course, part of that was the year before Burrard Bridge was under construction with Burrard and Cornwall, but of course the connections that Burrard-Cornwall as a new intersection all the way through to Seaside Greenway to Point Grey Road, more people are choosing now to use Broadbridge than previous. And then you kind of look at all these other locations, in 10th and Clark, the Viaducts, and Hornby Street. We're getting anywhere between 7 and 15% increases just over the last year. And so this is very exciting. And then you take the efforts of the Ministry of Transportation, just have the causeway, making some walking and cycling improvements. Well, did you know that Lionsgate almost has as many people biking over the last year as Hornby and Dunsmuir? So again, this is actually the great thing of actually having more access to kind of continuous data, and it itself is seeing increases even in advance of those safety improvements that are now going to be soon underway. I always like to bring data to excite Gord, so this one hopefully will be even more interesting for him and hopefully a few others. So Hornby Street, we've kind of combined and looked at some things. Now, Hornby Street, if you weren't familiar, it carried anywhere around about 14,000 cars before we put in the protected bike lane and what used to be the painted bike lane. And so it more or less didn't change in terms of the number of vehicles. It was parking actually that created the space for the protected bike lane. So there you go, approximately 14,000 vehicles a day, relatively unchanged over the last 5 years. So now we introduced the protected bike lane. I can see that the numbers are hard, so I've kind of given it to you in a little more easy. We're now up to, in the summer months, up to 2,700 people per day. But more interesting than that, since over the last 3 years since it's actually been implemented, we've seen an over 50% growth in that. And then we just did our second pedestrian survey counts. We did one in 2008, and we now did one in 2013. Now the sidewalks, and we only counted them over 7 hours, are moving over 5,000 people on Hornby Street. On the western side of the street, there was a 10% increase over the last 5 years, and that's buffered by vehicle parking. But on the other side of the street, where the cycle track is, and it's got the 2 rows of trees, at least by the law courts, you're actually seeing an even higher growth, 20% growth in the people walking, which makes sense, right? You're farther away from those moving cars. You've got some other nice people biking by in both directions and creating one of those healthy and social connections that we're learning to use here as engineers and planners. And so the overall summary, and now we've actually broken away the vehicles into actually kind of a per lane basis, and you're starting to see the scale here of sidewalks, cycle tracks. They're catching up to those vehicle lanes, and Hornby itself is actually moving more people overall, and that's healthy for all types of reasons, including the businesses. But I guess more exciting for us is actually the increases that are happening kind of in those healthy, active people. And then previously we had shown to council that the conversion from a painted bike lane immediately into the protected bike lane, what we were seeing, and it's just an indicator, but when you look at the demographic of the percent of women who are using one of these new protected bike lanes, it actually increased. And then another year later, it increased some more. And remember, now there's about 50% growth happening in terms of the number of people. And then pleased to report out that even just last year when we did demographic count. Now this is actually hitting our citywide average, something that you'd probably see more on an ADNAC or a 10th Avenue bikeway. So this is showing that the downtown now, with more of a protected bike lane network and more things to come, is actually being more comfortable and safe for people of all ages and abilities. So that leads us to a bit of a promo. We want to make sure you're all aware, and we have this ITE Quad Conference. If you're not part of that, that's okay, because really it's just a warm-up event. We are hosting, along with other partners, Pro Walk, Pro Bike, Pro Place here in September. And so whether you're thinking, well, I'll be going to the conference, or maybe I just want to volunteer and be a part of the many things that normally come along with a conference of 1,000 people, we're just really looking forward to this. It's managed and led by the Project for Public Spaces. They got a good track record. They did a great one in Long Beach and just one recently in Pittsburgh. It's once every 2 years. And so the main host city partners, in addition to the City of Vancouver, are Vancouver Coastal Health. So we're great that Jat's here and others at Coastal Health involved. And actually the Ministry of Health is involved. They're one of the key partners. Their lead kind of arm and partner in this is the Center for HIP for Health and Mobility, but we got links now to the provincial government in terms of hosting this event, and then therefore hopefully even connections to the Ministry of Transportation. And then TransLink, of course, would make sense in terms of as our regional partner. And so we with Coastal Health are building off some things that we did together, Healthy People, Healthy Places. Project for Public Spaces is the organizer. So there's a couple of these little bit of flyers if you want to grab one out, actually, because I should mention the exact dates if you want to put them on your calendar. September 12th to 15th, 2016, and we look forward. I mean, this is sort of a warm-up event, but we look forward. We're going to have a couple of other mini events between now and September, but certainly look forward to engaging and working with you all for more active transportation health in September 2016.